Hello, my name is Denise Lorenzo, and this is my presentation for my population level health education intervention project for Nursing 447. Introduction. After completing my windshield survey project in the underserved low-income community in Santa Ana, I determined that the four health-related issues that this population has are obesity, diabetes, homelessness, food sanitation, and safety. Education interventions were designed with appropriate learning goals and evaluation of the effectiveness of the interventions. Background and significance. According to a joint study from UCLA Center for Health Policy Research, there is a growing epidemic of childhood obesity, which affects 52% of children in Orange County. Obese or overweight Latino children ages 2 to 19 are at 38.9%, and obese or overweight Latino adults are at 77%. Because 23% of Latinos live below the poverty line, they're hard hit because of their lower socioeconomic conditions. According to the American Diabetes Association, Hispanics are at higher risk for type 2 diabetes than non-Hispanic Caucasians. It was found that the prevalence of total diabetes were roughly at 16.9%. According to CBS LA, the city of Santa Ana has one of the largest population of homeless population in Orange County. More than 4,700 homeless people were identified in a point in time county in Orange County this year. Foodborne illness or food poisoning also affects about 1 in 6 Americans in every year. That is 48 million people. CDC estimates that of these cases, there are 128,000 hospitalizations and 3,000 deaths. Healthy People 2020 Objectives. This project was developed with these objectives in mind. For obesity, reduce the proportion of children and adolescents who are considered obese. Diabetes, reduce the annual number of new cases of diagnosed diabetes in the population. Homelessness, increase the proportion of homeless adults with mental health problems who receive mental health services. And food and sanitation and safety, to reduce infections caused by pathogens transmitted through food. Needs assessment. In order to promote health education, it was important to perform a social assessment to learn the population's perceptions of their own needs and quality of life. During the windshield survey, observed that most Latinos were overweight and obese. There was a lack of stores selling healthy food. When I went around downtown Santa Ana, I saw unhealthy eating habits. Clusters of fast food restaurants and taco carts were everywhere. Foods high in fats and carbohydrates. Foods were sold in carts uncovered. Food utensils were uncovered. Underlying poverty in this low-income community, where there is limited access to healthy food was a barrier to proper nutrition. Lack of safe, well-equipped parks and playgrounds were noted. 2 parks where I went to and visited, French and Jerome parks, were empty during the day and did not have any well-equipped playgrounds. Homeless population were also found in downtown Santa Ana Civic Center and along the Santa Ana River. Interview with key stakeholder, recreation leader Rocio at the Santa Ana Senior Center revealed that financial constraints was the primary cause of obesity and diabetes. Interview with program coordinator Jose at the Boys and Girls Club confirmed that the same socioeconomic reasons are the cause of unhealthy eating habits in the children. Interviews with seniors at the Senior Center revealed they do not really pay attention to what they eat. They stated it was more money to buy healthy food. They lack education and prevention and managing diabetes. And interviews with the school children revealed that they lack education and healthy eating to reduce obesity. Interview with a homeless person stated he ran away from home due to alcoholism and did not get any support. Based on the results of the windshield survey and interview from the key stakeholders and popular stakeholders from the community, I determined that education, obesity, diabetes, food safety, handling, and homelessness would benefit the community. Theoretical framework and needs assessment. I used a proceed and proceed model to guide the planning development of my education prevention project. For the pre-seed phase, the social assessment was done. Epidemiological, behavioral, environmental factors were also considered. Educational and administrative barriers were identified. It was determined that due to poverty and lower socioeconomic factors, obesity was a common problem in the community of Santa Ana, and it was related to the prevalence of diabetes. And availability also of safe recreation centers was a contributing factor. Low literacy, language problem, predisposing factors included their knowledge, beliefs, and attitudes on these health issues. Administrative challenges I had to deal with, including strict requirements for volunteers, but the ultimate desired outcome was to provide education to address the health issues on obesity, diabetes, homelessness, food safety, and sanitation. For the proceed phase, implementation of the different interventions to address the health issues focus on proper nutrition, safe recreation centers, diabetes management, food safety, community resources for the homeless population. Education materials included PowerPoint presentation, handouts, activities, and exercises, including post-tests. Questions and answer sessions were also conducted. The process evaluation described the activities that were done in preparation for the education workshop. Short-term objectives were developed to measure expected outcomes, and long-term objectives will be measured in line to meet the objectives for Healthy People 2020. Issues for education and practice. Barriers to education practice included internal barriers from clients' lack of motivation, stress, boredom, lack of appropriate skills, and disbelief that behaviors are changeable. Environmental barriers are also affordability of healthy food, lack of resources, unsafe neighborhoods, lack of facilities to support positive behaviors. Administrative organizational issues also were included. The county personnel were busy, they were hard to reach, there were many requirements to fulfill, and there were insurance liability agreements that were required before you can provide education to the community. Assets of the population, though, included existing cultural practices and specific behaviors that must be acquired to strengthen and reduce the effect of problems, included discipline, self-control, more acculturation skills, adaptability and self-care, competent skills and knowledge about the health issues, and availability of community resources for the homeless population. Now, these are my interventions into the topic of obesity. Target of population, school children in the Boys and Girls Club in Santa Ana. During the workshop, children were educated on what obesity is and its causes, illnesses related to obesity like diabetes, heart problems, and stroke, eating healthy food, 5 or more servings of fruits and vegetables, having treats, they're okay if taken in moderation, scheduling regular meal times, cutting back on TV time, exercising at least 60 minutes daily. Education materials were handed out, included PowerPoint presentation, handouts, question and answer sessions, activity exercises, and a post-test to test knowledge. This education workshop met the guidelines on Healthy People 2020 and obesity, reduced the proportion of children and adolescents who are considered obese. Next, intervention on diabetes. Education was provided to the senior center, seniors at the senior center McFadden in Santa Ana. Senior community was educated on diabetes, the kinds of diabetes, prevention and treatment, healthy eating, limiting carbohydrates and starch, standards of care for diabetes, including tests for A1C, blood pressure monitoring, cholesterol checks, eye exams, foot exams, flu shots, and pneumonia shots. Education was provided using a PowerPoint presentation. There was question and answer, handouts were given out. The use of an interpreter was included, and this intervention met the guidelines of Healthy People 2020 on diabetes, reducing the annual number of new cases of undiagnosed diabetes in the population. Next intervention was on the topic of homelessness. The population was educated on mental health and mental illness, effects of alcoholism as a disease, 3.3 million deaths every year as a result of harmful use of alcohol. They were provided ways of transitioning from homelessness to self-sufficiency, self-care. They were provided education and community resources, also provided information on new replacement of social security number, provided emergency numbers for mental health, financial employment assistance, food bank, shelters, and mental health services. Education was provided through the use of handouts, information materials, and brochures. This intervention met the guidelines of Healthy People 2020 and homelessness, increased the proportion of homeless adults with mental health problems who receive mental health services. The next intervention will be on food sanitation and safety. Clients were educated on statistics on foodborne illnesses. 1 out of 6 Americans get sick from contaminated food, causes of food poisoning, bacteria, viruses, and parasites, symptoms of food poisoning, including nausea, vomiting, diarrhea, prevention, proper hand washing, proper food preparation and storage. And these objectives were met on Healthy People 2020 and food sanitation and safety, which is to reduce infections caused by pathogens transmitted through food. Education is provided by using handouts and activities. A Q&A activity was done, and discussions were also conducted. Budget. The time spent on coordinating this projects was discussion on the project site and development of the project. Key stakeholder meetings was 20 minutes meeting to discuss the type of audience and topics to be discussed. Expenses for materials included was for handouts and printing fees. The interpreter was free. This was a volunteer project, but if this was a paid assignment, total expenses would be at $400. Project evaluation and outcome. For obesity, the objectives were 75% of the school children will demonstrate knowledge and healthy and proper nutrition by the end of the class. They will be able to verbalize facts and needs about proper nutrition, participate in exercise activity to increase physical activity, and will pass the 4 questions quiz by the end of the class. Objectives for diabetes included. By the end of the workshop, 60% of the seniors will be able to define diabetes. They will know the 2 kinds of diabetes and their causes, and also they will verbalize strategies to prevent diabetes, and they will be able to answer the 4 questions on diabetes. On homelessness, the goals and objectives are 75 of the clients will verbalize the importance of mental health. They will be able to verbalize understanding and effects of alcoholism. They will verbalize ways to transition from homelessness to self-care, and also to have knowledge and availability community resources. And lastly, the objectives for food safety and sanitation. 75% of the clients will verbalize importance of food safety and sanitation. They will verbalize causes of food poisoning and foodborne illnesses. They will know the symptoms of food poisoning, and they will verbalize knowledge and prevention of food poisoning. Project evaluation and outcome. The success and failure of my interventions were measured by means of impact evaluation by meeting the short-term objectives that I just discussed. And also another measurement was outcome evaluation, if the expected changes will occur and will have long-term health outcomes. And this is in line with the long-term goal of the objectives for Healthy People 2020. Results and conclusions. The four health issues in the underserved population of Santa Ana are obesity, diabetes, homelessness, food safety, and sanitation. The underlying risk factor to this population is a socioeconomic condition and low income status. Effects of poverty and homelessness lead to health conditions like obesity, diabetes, and potential foodborne illnesses. Education was focused on healthy eating habits, physical activity, practicing food safety, sanitation, and community resources for the homeless population. The objective of this education workshop were developed with objectives of Healthy People 2020 in mind and will be the long-term goals of this project. The weaknesses of this project and the problems I've encountered, it was difficult to have a professional presentation due to the lack of equipment. There was no projector, senior center, and at the Santa Ana Club. Some of the seniors were also sarcastic during the presentation. They wanted me to give out money. They said that's what they wanted, not talking. Lack of motivation also and engagement were observed with the children at the Boys and Girls Club. If there was more time, I would have assessed the readiness of the population on learning. And if I was to do this again, I think more time and preparation would have been more effective and the availability of the right equipment. A pre-meeting would have been done to assess the client's willingness to learn. These are my references, 2 pages of them. And this concludes my presentation, and thank you for listening.